Agri-Safe. I'm just going to do one more sound check. I think we're good, right, Stacy?
Yes, it sounds good, Natalie. Go ahead.
All right. Thanks so much. Okay. Well, thanks everyone for joining us. This is a short session today for about 30 minutes, but we want to use the opportunity to introduce you to the AgriStress Helpline. It is a 24/7 crisis line that was built for farmers and ranchers. Joining AgriSafe today is ViaLink, and they're a nonprofit based out of Louisiana. And Sherrod Crespo is going to be presenting here in a few minutes. And she's an LCW, and she's the Director of Outreach and PCAL. She'll explain a little bit what that's about. But we're really excited to have ViaLink join us today because they do amazing work in crisis response, and we could not be doing this work without them. Just a little background about AgriSafe, if this is your first time with us. We are a national nonprofit, and our job is to protect people who feed the world. This is a pretty big charge because you can imagine all the risks in agriculture are quite diverse. And we certainly could not do it alone if it wasn't for the partnerships that we have. And also this idea that we have a responsibility to serve. We serve the needs, the occupational health needs that farmers and ranchers and farm workers are facing. And we also have to think about innovation because we are a public health organization, and with agriculture changing rapidly, so does access to healthcare, public health strategies. And so innovation is really a cornerstone of our work. And I feel that the AgriStress Helpline is a great example of an innovation that we've been working on for many years. And there was a demand for it specifically in this past year to really move forward. So you'll learn about that innovation and about how we hope to expand it on a national scale.
Natalie, I'm going to have you pause for just a second and make sure we get your screen sharing set up here for you.
Okay.
I can tell it's trying to find it, but it's not sharing with the audience yet.
All right, let me go ahead and try it again. So this is just shows you our tagline again. As I said, there's 3 ways that we protect, which is through people, partnerships, responsibilities to serve, and innovations. So really excited to talk to you about the AgriStress innovation. What we're going to try to accomplish today is quite a bit, but we want to make sure that you have really good knowledge about the crisis line. And just to confirm, are you able to see my slide okay?
Yes, you're good.
All right, good. As I mentioned, this is an innovative crisis model that serves a critical unmet need. I'm going to explain a little bit about that unmet need, specifically why farmers and ranchers are at risk. But I also want to make sure that you understand how it was designed, that it was designed by credentialed professionals, and that AgriSafe knew that we were not experienced in this field of crisis response. We don't have a call center here. So I want to make sure you understand how the model was designed and hear from ViaLink so you understand the best practices in crisis response. And then also want folks to learn a little bit about what is it when we talk about care navigation. So when somebody calls the line, what they can expect and what really is a standard in crisis response. So I think the best folks, again, to hear about that or to teach you about that is ViaLink. So we'll be talking a little bit about what it means when you call the line and what their responsibility is as responders. And then finally, at the end, I want to just leave a few minutes to talk about what expansion could look like, how new states could come on board with a crisis line for farmers, and also how perhaps a national line could be feasible and actually economical. So spend some time with that. So quite a bit on the agenda for today. As I mentioned earlier, AgriSafe's job is the health of the farmer and rancher. And I just want to put this out here so you understand our whole approach is very holistic, and that is true also with the crisis line. We recognize that at any given time, a farmer may be at risk both for physical harm as also for mental harm based on a lot of moving factors. They could all of a sudden have a natural disaster that could wipe out, their crops. It could damage, their buildings. That could also take a serious mental toll. So here at AgriSafe, we don't look at the total farmer health as just the physical well-being of the farmer and the farm family, but we look at their total farmer health, including their mental health state. And there's no question that there's been a lot of great work being done in the area of reducing stress for farmers, recognizing that they are a population that really take on a lot. They don't ask for help, but yet they are navigating fluctuating prices in the economy with their sale of commodities. They are dealing with, again, weather events that can be really substantial in terms of impact. And there's no question that, there are times of the year that are definitely much harder than others. During harvest time, getting very, very poor sleep. And certainly just the structure of farming, like the business structure of families working together, spouses coming together to work, but brothers and sisters and family members, a lot of generational issues. So here at AgriSafe, we recognize that farmers are really navigating complex situations and could be at risk for quite a bit of stress that really at the end of the day is not necessarily going to go anywhere. When a natural disaster hits, it hits. And then they're going to be focusing on making sure to navigate or to reduce future loss of their business. So, this is a population, is not surprising, that is at high risk of death by suicide. We know the numbers have fluctuated, through the CDC. Sometimes they're at the top 5, sometimes they say they're the top 3. But regardless, we know that they are at high risk. And when you think about the complexity of what a farmer for multiple generation is having to navigate, where they might have been part of a generational dairy farm that's been handed over for multiple generations, but during COVID, there was no way to bring the milk to actually get processed. So they're dumping the milk, and they were already, not getting a good return on that milk to begin with. And now they have to dump the milk because there's not even a processing plant that can process it. You can imagine the stress on particular industries. And we know dairy, for example, has been hit hard with a high rate of death by suicide. So, there isn't any other group I can imagine that really could benefit from a very distinct line, crisis line for them, built for them, that is responded to by people who are trained in understanding agriculture, who are trained in understanding the unique risks for those particular states, and also who want to continue to invest in understanding any events that could create an acute response or acute crisis for people. And so the idea of a crisis line, again, is, something that for agriculture is, if you look across the nation, you're not going to find a specific crisis line that is intact, that has to do with crisis responders who are ready to respond in terms of suicide risk. There's a lot of great work being done, providing resources to farmers through hotlines or numbers. Like Farm Aid does a great job of really assisting the farmer in getting access to the right resources they need. But a mental health crisis line that can respond to folks that are at risk of suicide, there was not one in place in the U.S. up until recently with the AgriStress line. So the AgriStress Helpline, and you can see our call flow here, did launch in February of this year. It launched in 4 states, and this was through funding from the state departments of agriculture. The states that it was launched at was Texas, Wyoming, Pennsylvania, and Virginia. Missouri recently came on as a state. Missouri Department of Ag awarded Agri-Safe the bid as of a week or so ago for the AgriStress Helpline as well. All 4 states all 5 states now carry the same name, the same number. And I'll explain a little bit later about why that is. But I'm showing you this flow diagram, and I apologize if it's a little hard to read, but we can certainly send that to you in a separate attachment. Go ahead and request that if you'd like. But I really want to emphasize something, and B-Link folks will explain it better than me for sure. And that is, when you see this flow diagram, the first responsibility is to make sure that folks are not at risk of suicide. And if they are, they're going to get the care they need, and the care they need is going to be best practices in this industry. It's going to be the same care they would get if they call 988, or as folks know it as a lifeline. And this was built intentionally this way because we don't want to ever have to tell a farmer to hang up and call another number, because we could risk losing them in between. And so this was built intentionally for this reason. The folks answering the call also answer calls for the lifeline. If the person is not at risk of suicide and it's not a suicide risk, they're going to be assessed for other mental health concerns, and they're going to be provided what we call crisis de-escalation and supportive counseling. at the end of the day, there's a whole host of resources that they could get referred to if they're ready to receive that, if the timing is right, and the counselor will determine that. But really, first and foremost, I want to emphasize this is a lifeline. So AgriStress Helpline is a lifeline. It's intended to save lives. We have a call and text feature offered, and also all the 160 languages offered. So it was built this way intentionally. Because of State Department of Ag funding that came available a year ago through a competitive process to the states. Again, we did have 5 states that wanted to run their crisis line through us. And I'll explain a little bit later about why I think that a national line would be an efficient next step. But I'm going to go ahead and pause here and really transition to the experts who are the ones handling the calls on a daily basis. So I'm going to pause my slides and turn that over. And the person speaking next is Shared Crespo.
Thank you, Natalie. Thank you all for being here today and for having me here today. I am just so excited to share with you all about what we do at ViaLink, what our contact center is all about, and this really unique collaboration that we've had with Agri-Safe to form a support community for farmers and ranchers. I am an LCSW social worker. I'm on the clinical staff at ViaLink and help oversee the contact center. My clinical expertise is in suicide prevention, intervention, and postvention. And I'm just going to kind of walk y'all through the foundations of our contact center and then how we have truly formed this amazing collaboration to assist the farming and ranching community through our contact center. So the ViaLink Contact Center, our specialists who work on our phone and text lines are extensively trained for over 200 hours when they decide to join our agency. The contact center training is evidence-based and it is developed and maintained by licensed clinicians. We do internally maintain, create, and upkeep our training so that we can always keep them elevated with best practices. The training, the policies, the procedures, they are constantly overviewed and updated to meet those latest best practices and adhere to the latest information and techniques that are available. We also do assess and monitor these techniques as they are implemented on the phone line so that we can actually see, okay, the evidence is here, is it working telephonically? And make sure that we are always adjusting so that we are delivering the best services we can to people who are reaching out for help. Our contact center is accredited by AAS, the American Association of Suicidology, and also by AIRS, the Alliance of Information and Referral Systems. So diving into our training a little bit, again, this is over 200 hours of training, and they are extensively trained on our foundational skills, which exist with providing emotional support, utilizing skills such as active listening and nonverbal communication, which are shown to be the best practices in providing emotional support and de-escalation, in particular telephonically when you don't have those nonverbals to communicate with. We are extensively trained in crisis intervention techniques, de-escalation techniques, suicide response, and risk assessment. For those experiencing thoughts of suicide, we do practice emergency room diversion. When we talk about suicide risk, that can mean a lot of different things. Is there an actual physical safety risk? If not, we really are trying to help that caller or that texter keep themselves safe, keep themselves calm, and de-escalate and learn how to live with the way that their brain works and that we can always be that person that's available for them. Our specialists are also trained in violence risk assessment and duty to warn laws in various states. The training consists of live lecture done via Zoom, at-home learning assignments and practices, live practice skills and quizzes and assessments, a lot of demonstration. The trainees will also live monitor current specialists where they're able to listen to calls as they come in live and see how our expert specialists do handle calls. Everybody must pass a final role play and a final exam. A trainee will not be permitted onto the lines until a clinical trainer approves that they are ready to go. And then their first few shifts are also going to be live monitored by an experienced specialist. So they're there. One, it's nerve-wracking, to keep cheering them on as they're going through their first few shifts. And in case they get stuck, they have a question, there's always someone there to make sure that they are able to adhere to all of this wealth of knowledge that they've been given. Our learning does not stop after that initial training. Our specialists are continuously monitored throughout the year and they receive extensive feedback. Our specialists also do receive supplemental trainings on topics like intimate partner violence, human trafficking, various behavioral health issues, substance use, and cultural topics. We also do host all staff quarterly meetings to refresh on topics, policies, and procedures, and answer any questions, any concerns that may be going on universally throughout the contact center. The contact center also is staffed by a team of on-call supervisors, which are available 24 hours a day. Our on-call supervisor team currently consists of 4 licensed mental health professionals, 3 program coordinators, and a quality assurance coordinator. We all take turns taking shifts for 24 hours in which everybody who is working or volunteering on the phone lines can consult with us if they have any sort of shift concern, if they need a consult on where they need to go with the call, if they need to debrief after a tough call to make sure that they're ready to help the next person that calls in, and any other needs that they have. We're available again for 24-hour shifts. There is always an on-call supervisor available for the contact center. So now seeing how we took this contact center that we already had, and we were able to collaborate with AgriSafe to provide this AgriStress Helpline. That's a mouthful. With AgriStress, all specialists who work on the AgriStress line have been trained in farm response. So this really allows this collaboration to be very uniquely suited to provide support for those in the farming and ranching community. So through us being able to partner with AgriStrafe, the contact center is able to apply their behavioral health skills with an extensive appreciation for the farming and ranching community and their daily life, their struggles, what's actually going on. AgriStress also does provide ViaLink ongoing trainings on specialized topics. So in addition, AgriSafe will update the ViaLink team on any local issues wherever there is a AgriStress line available. So if there's been a natural disaster, a particular economic stress, anything that might be affecting that community, our contact center is updated. That way they will have some background knowledge should we receive an influx of calls, or so that every caller is not going to have to explain the background of the social situation of what has been going on. So this really gave us a lot of cultural training to really be able to meet farmers and ranchers where they're at with an even more specialized degree. So our goal, the goal of the crisis line, is to provide a uniquely safe space for individuals who find themselves in need of support. It can be super difficult to reach out for help and admit that you're struggling. And the crisis line provides an anonymous and confidential safe space to ask for that support. You don't have to worry about who's going to see you, what are they going to do, is someone going to gossip about me, are they going to try and ship me off somewhere? Our goal is for callers to feel like they can let out everything that they're going through and us to help them navigate maintaining their internal locus of control. It's providing a space for callers to let out anything and everything that is affecting them. And because our lines are available 24 hours a day, users can call in whenever they may feel that they're at that breaking point or that they need that support. There's no worry of upkeeping of appointment times or anything like that. The goals are for us to first hear the caller, listen to their whole story, and provide a safe space to be able to let out whatever it is that they've been keeping inside. We're going to validate and identify emotions. That component of identifying emotions is crucial in crisis intervention. We're going to establish if there is any presence of suicide ideation. If applicable, we will assess for safety risk. And we're going to collaboratively establish a short-term plan for coping and safety if that is applicable within the caller's unique needs. Follow-up calls are always offered to check in on the callers within the next 24 hours, and when it's applicable, referrals can be offered. It's really important, like Natalie touched on, that callers de-escalate and have a plan for coping, have a plan for relaxation for the day, for the evening, because that actually will return the caller to their normal state of neocortical functioning. When someone finds themselves in a crisis situation, the way our brain is firing literally changes. And you have to implement self-care to refresh the brain, reset it, get things firing on all cylinders so that that referral process can actually be effective. The access to the crisis lines provide 24/7 support, which encourage and maintain internal control and well-being. Wherever you go, there you are. And that is what we're really trying to instill with anyone who calls or texts us, to let them know that we're meeting you exactly where you are at with your needs, no expectations on ours, just how can we help support you in this moment. crisis lines do also provide an excellent access point to that continuum of care in the behavioral health community if that is the need of the caller. But nothing is too big or too small to ever give us a call. We are able to also gather and maintain data on users of the line. Confidentiality will always be upheld to a very strong degree, but we do have the ability to gather some demographic data and callers' needs data, and that can inform program needs in the communities as a whole. Attending to the caller will always come first for our crisis calls. We will never put getting demographic data above meeting the caller where they're at, but our specialists are trained to document any data that they do receive throughout the call. So communities who are part of this AgriSafe network, knowing what the needs are in their community, the demographics of the people who need these services, and more importantly, where are their unmet needs, where are their gaps in service, can really provide real-time information on program development and implementation for behavioral health resources in communities. So that is my spiel on V-Link and what we do here, and I welcome any questions if anybody has any.
Thank you so much, Sharon. And we're monitoring the questions. And so if folks have additional questions, we're going to go ahead and take care of those in a few minutes. You all can see from the presentation that Sharon did, there's a reason why here at AgriSafe, we recognize that we needed to work with organizations like V-Link. They are, as I said, a nonprofit, but this is what they do. They handle crisis calls centers for example, LSU. They are the crisis response center, and the customized approach to the AgriStress Helpline is so critical to what we're doing. And I can't thank them enough for the fact that even aside from the initial training they received and the farm response training, they're continually wanting to learn. They constantly in touch with us to say, hey, you know, I heard something happen in Pennsylvania, for example, like what can we do? What can we be ready? And so really very thankful for the partnership. And there, you know, for us to have realized that it would not have made sense for AgriSafe to become a call center when there are folks that do this so well and have perfected it. I'm going to switch gears and just talk a little bit about what it means to expand this number. And there's actually a question that came in about if a state was interested in having this line in their state. I just want to make sure my screen's showing okay. So I think we're good there. The slide that you see here is an example of a promotional campaign in Pennsylvania. You can see that it shows that there's a text and call feature available. And so for the states that carry the crisis line, they all have the same name of the line, the same number. And you can see it says for Pennsylvania. The reality is that anybody who calls this number, whether you live in Utah and you call the number, you're going to get serviced. And the reason why you're going to get serviced is because being as a crisis line, we can't ever turn anybody away. Because we only have the funding in the 5 states for the crisis line, we're being very mindful of promoting the number, you know, just in those 5 states, the best of our ability. But again, folks from out of state can call. In order to adopt a line in the state, you know, the first step is to reach out to myself, and I can provide my email in this, or maybe Stacy, you could do that in the chat. I'm again Natalie Roy, the executive director, and we would talk about what the needs are in the state and look at getting you a quote based on the number of farmers. So the cost is different based on the number of farmers in the state. So Texas, being almost 500,000 farmers, is paying more for their crisis line than the state of Wyoming, for example. Where AgriSafe comes in is in the marketing and the training aspect of the line. So again, we're not here at AgriSafe, we're not answering the calls, but we have a close relationship with V-Link in terms of the whole line itself. One of the things that Sharon mentioned, which is really important, it's part of this idea of a national scale up to the line, is what we called farm response. And I just wanted to explain that a little bit more. So if you're not familiar with it, AgriSafe did launch a 3.5-hour course called Farm Response. It's on demand. You take it at your own time. And the reason for this course was because we believe that doctors and nurses and social workers and other mental health professionals in rural America that are caring for farmers, they really need to get access to a curriculum to help them understand what the stressors are that those who work in ag are dealing with. And so it's not a course to teach folks how to provide mental health care, but it's to teach them like why are family dynamics really complicated in agriculture and can lead to stress? How can opioid misuse be different in agriculture, those who work in agriculture versus those that don't work in a high intense industry? And so if you look at the different curriculum modules here, you can see it's really a deep dive on what are the stressors in ag, because what we want to have happen is we want to build out a network of providers, primary care professionals, mental health providers who are invested in agriculture and who understand that when they talk to farmers, they need to meet them and understand how their stressors are unique. For example, we never want to tell a dairy farmer to take a 2-week vacation because that's not, probably very feasible. So the thing about this course is that while we are offering the crisis line in these 5 states, at the same time, we're building out what we call a farm response network, building out professionals in the state that have taken this course so that if they call the helpline and they're looking for help and actually getting access to care, getting access to a mental health professional who understands ag, we'll have a network built out to refer them to. And it's really important. Right now, that network isn't in place because this farm response was launched about the same time as a crisis line. What we're excited to say is that we have, I think, about 700 people who have registered to take the course, and folks are at different levels. But the idea is a year from now, we'll have hopefully at least a couple hundred in Texas that have taken farm response, all the different states that we have the helpline. In addition to those states where the helpline is, we also have farm response programs running through the nation. So I want to emphasize how critical that is for a next step, is that we've got the crisis line in place. We have this course in place. We really want to have a situation where farmers can get access to care by people who understand ag. So that's why the farm response and the helpline are really sort of a marriage of 2 innovations. Here again is an example of the states we have. The reason why Agri-Safe is very interested in a national line is because these states are really the pilot, but because of the fact that anybody can call from any state, it makes it hard to really do hard national marketing without it being nationally supported. So for long term, this is funded through state departments of ag funding, but it is short-term funding. It's likely only a year or so. And AgriSafe is very interested in looking at a national launch of this line so that we can, from coast to coast, make sure that those who work in agriculture have access to this. And that's something, if you're interested in a national rollout and what that means and how to support this work, please reach out to me because we really need to have partners on board that have a vision for this in that capacity. So I'm going to stop there and see if there's any questions that I failed to answer. Let's see. Pause my screen here, check and see real quick. And also there might be questions that folks at the link could answer too, if I can't. Someone has said that they feel the barrier to make the first call is hard to convince farmers to call, but maybe there's a good response. Is there successful ways that you've found to advertise a service? That's a great question. So we are literally, this just started February 1st. So we've got some really great partners, like in Texas, for example, the Southwest Ag Center, which is a NIOSH funded ag center, has been doing some amazing work in outreach. The states have themselves, the state departments of ag have really gotten behind the marketing efforts. Like in Pennsylvania, they do a lot of press releases. So in each state, it's a little bit different. What we want to do is try to build out not just the call for action to the person that may be struggling, but also another approach is also folks that are caring for someone that they think might be at risk of suicide. So we'll be launching a campaign specific to that, where we'll provide support and encourage folks who are caregivers or a spouse to call the number on behalf of somebody else. So that specific campaign probably won't get well underway for another 3 or 4 months because we've just started on that. So I think that one of the things we have to realize is it does take time. We have examined success of other lines, and there's been quite a bit of success after you have about 5 or 6 months in, where billboards, for example, have been successful. Those are things that we'll be testing out, but are hard to say because in rural America, you may not have the same impact on a crisis line on a billboard as you might, close to an urban setting. Let me see if there was another question here that came in. Whoop. All right. Sorry, trying to get to this. Oh, here we go. Okay, so the states that are currently participating, I think that's been answered. We've got 5 now. And then if a caller lives in a rural area, how do you handle referrals in areas with lack of mental health resources services? Okay. So, oh, looks like Carrie, you've answered that. So just to kind of bring people's attention to this. So what Kara said, for rural areas where there's lack of resources, they mentioned that AgriSafe source referrals and provides an extensive list of resources, and then V-Link vets those. And so that's true. So each of these states, and the reason why it takes about, from the point in which a state signs on, it takes about a good month to really be ready to serve. Even though the line, like I said, anybody can call from any state right now. But let's say, like we just added Missouri, but we're waiting for another couple weeks to do a really big launch of it because we have to source all the 911 numbers have unique numbers so that if someone's in crisis, you have to be able to call that unique number and dispatch emergency services. So all that resource sourcing is part of that arrangement with V-Link. So we do a lot of that as well as V-Link has their sources that they use as well. And then one of the questions was, for individuals who need continued behavioral health care, does the staff have access to free state specific vouchers for care or connect them to behavioral health specialists in the area? And again, that's what Kara said, that there's an extensive list of behavioral health resources. Certainly those keep changing. Like if especially the states where we have the crisis line, if someone knows of like a new program that came in place where now there's like free services, mental health services, and we don't have that in our queue, we're going to add it. One of the things that we certainly know is a big issue is that what we call mental health parity laws. So people don't realize that with their insurance now that there should not be, if it's comprehensive care, they should have access to mental health care services. But for so long, people would see that as sort of an extra luxury in their insurance. So they figured, well, I can't go see the counselor because I'm going to have to pay out of pocket. Mental health parity laws mean that if someone is paying for comprehensive care, that mental health services can't be put in a lower reimbursement level than other services that are needed. But people for so long have remembered that they just don't have access. They don't think they have coverage. So again, that's a part of what this helpline can do, is that as we continue to roll out campaigns. Now, granted, you don't need insurance to call this line, but maybe someone's hesitant to go seek care because they think it won't get coverage. That's all work that we can continue to do to promote good health. I think I got a couple ones I didn't answer. Okay, does it need to be the whole state, or can counties within a state partner with AgriSafe to offer AgriStress? That's a great question. Oh, I don't know if I've had that. We can talk, like if folks are from a county and they're interested in it for their county and they're not able to like support it statewide, just reach out to me, and maybe Stacy, if you don't mind putting my email in the chat as well as my phone number, that would be great. Yeah, we get, and then maybe that there may be groups, counties are interested in it, but maybe that folks at the state level are very interested. You just don't know about that with each other. So we can have those conversations for sure. I want to make sure. Sharon, is there anything else that you'd like to share? I'm looking at these questions, make sure I didn't miss anything that can speak to anything. Oh, some more coming in. I think it looks like Kara, we got Kara behind the scene at V-Link. She's helping us out. Someone says, how does it go if someone speaks a different language from English? So Sharon, could you answer that question live for everybody? If someone calls and they don't speak English, what happens?
Sure. We would utilize our translation service. It translates over 160 languages. We try our best to just identify the language properly, and then we are able to in real time connect with that TransPerfect service. And then we speak directly to the person. It's not as if they're skilled in being able to make it a one-on-one conversation, just with that translation in between, rather than us like not speaking directly in first person to the caller. We have yet to have any issues or complaints with handling it that way. We do try and employ employees or volunteers when we can, who do speak a different language. We just don't always have that on staff, but when we do, we have ways of queuing that as a priority.
Great, thanks. And the chat feature is really interesting. I don't know, Sharon, if you could share a little bit about that, because it seems like I've heard in some literature as well, they mentioned that chat can actually be as popular as phone calls, or if not more.
Absolutely. We get a lot of volume on our text and chat features. I think because it's just really how more people communicate now. It's really shifting to that direction. And it leaves even more of a level of anonymity when you're feeling hesitant about reaching out, or even disclosing what's actually going on with you. That not even having to hear someone's voice can make it even easier for someone to really divulge what they're going through. And it gives you a little bit of time. You can think about your responses, think about what you want to say. So we have found text and chat to be incredibly popular ways for people to get connected to support with us.
Great. Thank you. I know I didn't spend any time talking about 988, and I know there was a big rollout on Saturday, and there's been some questions that were sent to us ahead of time about how does the AgriStress Helpline work in conjunction with 988, and what are the differences there? And I want to just address that just for a minute. Moving to 988 is a great accomplishment in terms of really providing an easy number that hopefully will save lives. That's the whole idea behind that 988. That lifeline, our national suicide number, it was a 10-digit number. Was hard for people to remember. So going to 988 is a big deal. It's not a new service because the lifeline was there before. It's just that the 988 makes it easier to access. So years ago, when we were designing the AgriStress Helpline, we had conversations with the 988 provider, which is called Vibrant. They're the ones that have a contract with SAMHSA. And to this day, we're still working closely with them. And we were trying to explore how to work together and not compete against lines. We don't want to confuse people in terms of what number they have to call. And so that's why I've really tried to emphasize that you're not going to ever be in a situation where you'd have to share the helpline, our helpline number, and 988 number at the same time, because our number is a lifeline number, just like 988, and we are following the exact same protocols that are expected with the lifeline, and we did that on purpose because we did not. Again, we don't want in a situation where if someone needs that support for suicide risk, that they're going to have to hang up and call the lifeline number. So the reason why you don't see it routed through 988 is because our helpline is intended to also do more than crisis response and suicide response. And so there's a whole host of resources available that are unique to agriculture that we just could not put through the 988 system because of the size of the system. And we could also not guarantee that the person answering the 988 is farm response certified. And so it came down to really a quality issue of this being such a specialized population. We did not want to risk the calls crisis responder not being trained in farm response. So there's a lot of reasons why it doesn't funnel through 988. And on top of that, you can't put people in a queue. So they couldn't call 988 and say, okay, 1 for veterans, 2 for farmer, 3 for doctor, that type of thing. So there was reason for that. Now with the helpline, our helpline, we also have a QR code that we promote out that I think I showed in an earlier slide. And that's done intentionally because we want people to put that number in their phone, whether they think they're at risk or someone else is at risk. It's important to have that emergency helpline number. Let's see, I know I'm getting a little bit over time here. Sorry for being winded on that. Let's see, I know this is a reactive, not preventive sort of thing, but does AgriStress or AgriSafe host really any virtual farm suicide survivor support groups? I've had farmers lose a neighbor or sibling and want to have a group to process through it with it. What a great question. We have not done any work to host or lead virtual farm suicide survivor support groups. And thank you so much for that question. And we're really going to take your question and work through some connections with staff internally and then be like to see what is happening in that space. And gosh, talk about a need there. Folks that have dealt with a loss to have a support group. And
Natalie,
uh,
at the last
sure.
AgriStress meeting, one of the people that provides care in Minnesota is leading some of these. So we do have,
Okay.
it's not us, it's not Agri-Safe that's providing that, but there are
Okay.
some people out there who are looking at too, recognizing this as a need too. So I don't have that right at my fingertips, but I know Carrie would have it.
Okay. Carrie
Um,
Portel. Okay.
And if I
Yeah.
could interject as well, we do subscribe to the national database of suicide survivor support groups. So we are able to refer callers to that. I do work directly clinically with survivors of suicide loss, and we do provide trainings to our staff who are on the phone lines as well, with providing that support space for the unique loss that it is of losing someone to suicide.
Okay. Thank you. Thank you, Sharon. And it looks like I've seen, there's also been a statement about Minnesota to provide that. So, and Illinois getting ready to start one. Okay. Um, I think for the, since we have folks email, we could follow up with, any actual contacts that people can use. Stacy, is that what you're thinking? Best way to give people that response?
Yeah, that we can sure do
Okay.
that.
Okay. And then maybe if you want to put Carrie Portel's email in the chat, Carrie Portel is leading we have a monthly, what we call innovation exchange, where we bring in folks to do sort of flash talks about their innovations in mental health for ag. And that's where Stacey was talking about. It sounds like we had a speaker. I missed that last one, but that would be great to connect. I think we've answered all the questions coming in. AgriSafe, we're a small nonprofit. I mean, we're national in scope, but we want to hear about what you need, what you're interested in. So do not hesitate to reach out. Again, my email, which is on the chat, is nroy@agrisafe.org. So happy that you all could join us today, and we'd love to hear from any of you afterwards to see how we can be supportive. And thank you so much, Feeling folks, for coming on board. We're very grateful for your partnership with us. Okay, everybody have a great day. Thank you.